Good evening, friends. Recently, I got a patient who was brought to me with complaints of severe abdominal pain. He had decreased sleep, he had loss of interest in surroundings. He said, "Sir, I have no interest to live at all. I have low spirits. I am dejected. I am in despair. The reason being this severe abdominal pain. Hence, I made a suicidal bid also. Unfortunately, my relatives saved me. These were the complaints with which a patient was brought. A 40-year-old female, loss of interest, decreased sleep, severe abdominal pain. I can't resist my temptation to tell you what I learned during my MBBS days, my final MBBS during 1975 at Government Medical College, Bellary. I must quote what the great teacher of mine, professor of surgery, late Dr. R.H. Shanai, had taught us during those days. It's nearly uh, 50 years of age, 50 years of time have elapsed since Dr. Shanai taught us that. But I recollected that anecdote when this patient was brought to me with history of severe abdominal pain. The same thing is written in Balian Law's short practice of surgery also, textbook of surgery. What should we think? How should a clinician move? I quote what was written in Balian Law's textbook of surgery, which Dr. Aratan Shanai recollected extempore and had taught us. Number one, any person who complains of dyspepsia for the first time after 40 years of age must be suspected to be having carcinoma stomach unless proved otherwise. This is a patient with severe abdominal pain. If he comes and he has problems of indigestion, constipation, diarrhea, etc., your thinking should go on these lines. Number second, these patients can present with 3 A's: anemia, asthenia, anorexia. Number three, they can present with obstructive symptoms, either hematemesis or melena. Number four, they can present with mass per abdomen. Number five, they can present with widespread and distant metastasis. Metastasis in the lungs, metastasis in the femora, long bones, or metastasis in the ovaries, also called as Kirkenberg's tumor. All these five symptoms I could recollect when the patient of 40 years of age came to me with abdominal pain, and due to that, she tried to commit suicide also. Not only abdominal pain, severe dyspepsia for the last 2 or 3 years. This is how a clinician's thinking should move. This is how a clinician should think. She did not have any carcinoma stomach or cancer stomach at all. She had very severe depression, endogenous depression. Abdominal pain can be a manifestation of severe depression also. Another disorder which we psychiatrists should remember when any patient comes to us with abdominal pain coupled with psychological symptoms, symptoms like mental confusion, or when you examine the patient has a peripheral neuropathy, he or she comes with tingling and numbness in the extremities. So, mental confusion, Psychiatric symptoms, abdominal pain. Think of what? Think of porphyrias. This is how one should try to progress in one's clinical thinking. This patient did not have any organic pathology, did not have any physical disorder. She had depression. But let me emphasize the fact that depressors also can have long lasting abdominal pain as their manifestation. One more thing I want you to remember, my friends. We psychiatrists diagnose psychiatric illnesses not only by the absence of physical symptoms or physical signs, but, mark my words, much more by the presence of strong psychological symptoms and psychological signs. Thanks a lot. All the best. God bless you. Thanks for watching. Please do share the videos. Bye bye.